every single day after the age of 50, your gums are quietly dissolving. Not dramatically, not with pain, just a slow millimeter by millimeter retreat that exposes the roots of your teeth to bacteria, decay, and eventually, tooth loss. The American Academy of Periodontology estimates that over 70% of adults over 65 have some form of periodontal disease. And here's what should terrify you. By the time you notice your gums receding, you've already lost years of tissue. Years. And your dentist? They'll hand you a pamphlet about flossing technique and maybe schedule you for a scaling and root planning procedure that costs $1,500 and does absolutely nothing to address why your gums are shrinking in the first place. Now let me be very clear about something before we go any further. I'm not anti-dentist. You need your dentist. But what I am against is the model that treats your mouth like it exists in a vacuum, completely disconnected from the rest of your biology. Because that model is failing you. You've been told to use antibacterial mouthwash. You've been told to brush more. You've been told to eat crunchy vegetables. And look, none of that is harmful, but it is profoundly incomplete. It's like putting a fresh coat of paint on a house with a crumbling foundation. It looks better for a week. Then the cracks come back. Because the real issue, the biological engine driving your gum recession, is happening at a level your toothbrush will never reach. Let me explain what's actually happening inside your gum tissue right now. Your gums are not just pink cushions sitting around your teeth. They are living, dynamic structures built primarily from collagen, specifically type I and type III collagen, produced by cells called fibroblasts. These fibroblasts are the construction workers of your gum tissue. They build, they repair, they maintain structural integrity. But after 50, something shifts. Your fibroblast activity drops, dramatically. Studies published in the Journal of Dental Research show that fibroblast proliferation in gingival tissue decreases significantly with age. Your construction workers are retiring, and nobody is replacing them. But it gets worse. At the same time your repair cells are slowing down, the destructive forces are speeding up. There's a process called lipid peroxidation, which is essentially oxidative damage to the fatty membranes of your cells. When your antioxidant defenses weaken, and they do weaken with age because your master antioxidant glutathione drops roughly 10% per decade after 40, those cell membranes start breaking down. Your gum cells become fragile, vulnerable. They can't hold their ground against the bacterial onslaught. And speaking of bacteria, let's talk about something your dentist almost certainly has never mentioned to you: quorum sensing. This is the communication system that bacteria use to coordinate attacks on your tissue. Individually, the bacteria in your mouth are manageable. But when they form a biofilm, that sticky, organized colony on your teeth and below your gum line, they start sending chemical signals to each other. Once enough bacteria are present, they reach a quorum and they collectively switch on their virulence genes. They go from passive passengers to active destroyers. And standard brushing, flossing, even professional cleanings, they disrupt the surface of the biofilm, but they do not break this communication network. The colony rebuilds within hours. So you have declining fibroblast activity, collapsing antioxidant defenses, and an increasingly organized bacterial army. That is why your gums are receding. That is the root cause. And unless you address all three legs of this tripod, no amount of brushing technique is going to save your gum tissue. Now, I promised you 7 secrets, and I'm going to deliver every single one. But I'm going to rank them, because not all of these are created equal, and I want you to know exactly where to focus your energy. Let's start at the bottom. Secret number 1, oil pulling with coconut oil. I'm going to give this a score of 2 out of 10. Now before you click away, hear me out. Oil pulling has ancient roots in Ayurvedic medicine, and there is some evidence that it can reduce certain bacterial counts in the mouth. A study in the Journal of Indian Society of Pedodontics found modest reductions in Streptococcus mutans after oil pulling. But here's the problem. Coconut oil has very limited ability to penetrate biofilm. It sits on the surface. It does not disrupt quorum sensing. It does not stimulate fibroblasts. It does not boost glutathione. It's pleasant. It might freshen your breath. But as a gum regrowth strategy, it barely moves the needle. If you enjoy it, keep doing it, but do not rely on it as your primary intervention. Secret number 2, vitamin C supplementation. Score 4 out of 10. Now this one surprises people because vitamin C is genuinely critical for collagen synthesis. Without adequate vitamin C, your fibroblasts literally cannot produce collagen. That's the biochemistry behind scurvy, the disease that made sailors' gums bleed and their teeth fall out centuries ago. So yes, you need vitamin C, but here's the preparation secret that almost everyone gets wrong. And this is important, so listen carefully. Most people take a standard ascorbic acid tablet once a day, usually in the morning with breakfast. And most of that dose gets excreted in your urine within 2 to 3 hours. Your blood levels spike, your kidneys dump the excess, and for the remaining 21 hours of the day, your gum tissue is running on fumes. The research shows that divided doses throughout the day, or better yet, a liposomal form that uses lipid encapsulation to bypass rapid kidney clearance, maintains tissue-level concentrations far more effectively. A single morning tablet of ascorbic acid is a preparation error that makes vitamin C dramatically less effective for gum tissue than it should be. Most people taking vitamin C for their gums are getting maybe 20% of the benefit they could be getting simply because of timing and form. Fix that, and vitamin C becomes a real player. But alone, it's still not enough. Secret number 3, coenzyme Q10, applied topically. Score 5 out of 10. CoQ10 is fascinating because it operates directly at the mitochondrial level of your gum cells. Your fibroblasts need energy to build collagen, and that energy comes from the mitochondria. CoQ10 is a critical component of the electron transport chain inside those mitochondria. Multiple studies, including research published in Molecular Aspects of Medicine, have shown that topical CoQ10 application can reduce gingival inflammation and improve tissue healing. But here's what nobody's telling you. The form matters enormously. Most CoQ10 supplements are in the oxidized form called ubiquinone. Your cells have to convert that to the reduced form, ubiquinol, before they can use it. And guess what declines with age? That conversion efficiency. So if you're over 50 and you're using a standard CoQ10, you might be absorbing a fraction of what you think. Look for ubiquinol specifically. And for gum tissue, you actually want to open the capsule and apply a small amount directly to the gum line before bed, letting it absorb overnight. Swallowing it helps your heart and your energy levels, but direct topical application is what gets it into the gingival tissue where you need it. Now we're moving into the upper tier. This is where things get powerful. Secret number 4, xylitol, but not the way you think. Score 6 out of 10. Xylitol is a sugar alcohol, and you've probably seen it in sugar-free gum, but its real power has nothing to do with being a sugar substitute. Xylitol is a biofilm disruptor. Research from the University of Washington showed that xylitol interferes with bacterial adhesion to tooth and gum surfaces. The bacteria consume it thinking it's a normal sugar, but they cannot metabolize it. It gums up their metabolic machinery. Over time, with consistent exposure, xylitol actually reduces the stickiness and organizational structure of the biofilm. It doesn't kill the bacteria. It confuses them. It disrupts their ability to form the organized colonies that trigger quorum sensing. This is a fundamentally different approach than antibacterial mouthwash, which nukes everything including the beneficial bacteria you need for a healthy oral microbiome. But here's the key. You need multiple exposures throughout the day. Research suggests a minimum of 6 grams daily spread across at least 3 to 5 exposures for meaningful biofilm disruption. A single piece of xylitol gum after lunch is not going to cut it. Small amounts dissolved on the tongue several times daily, or a xylitol rinse swished after meals, that's the protocol that actually works. Secret number 5, glutathione restoration through its precursor N-acetylcysteine, also known as NAC. Score 7 out of 10. Remember when I told you that glutathione is your master antioxidant and it drops with every decade? This is where you fight back. You cannot effectively supplement glutathione directly because your digestive system breaks it down before it reaches your cells. But NAC provides the rate-limiting amino acid, cysteine, that your body needs to manufacture glutathione on its own. A study in Free Radical Biology and Medicine demonstrated that NAC supplementation significantly increased intracellular glutathione levels in aging subjects. And here's why this matters for your gums specifically. When glutathione levels are restored, lipid peroxidation decreases. Your cell membranes stabilize. Your fibroblasts become more resilient. The oxidative environment that was accelerating tissue breakdown starts to normalize. You're not just adding a bandage. You're restoring the biochemical environment that allows healing to actually occur. 600 milligrams twice daily on an empty stomach is the dosage most frequently used in the research. And this is one of those interventions that benefits your entire body, not just your mouth. Your liver function, your immune system, your brain, everything benefits from restored glutathione levels. Secret number 6. Vitamin K2, the forgotten vitamin. Score 8 out of 10. This is the one that almost nobody is talking about, and it might be the most important missing piece in your oral health strategy. You've heard of vitamin K for blood clotting. But vitamin K2, specifically the MK7 form, does something entirely different. It activates a protein called matrix GLA protein, which directs calcium into your bones and teeth and away from your soft tissues. But for gum health, K2's role goes deeper. Research published in the European Journal of Clinical Nutrition showed that K2 activates osteocalcin, a protein critical for the health of the alveolar bone, the bone that anchors your teeth. When that bone deteriorates, your gums have nothing to cling to. They recede. Not because the gum tissue itself is weak, but because the foundation underneath is crumbling. K2 also has documented anti-inflammatory effects on gingival tissue through its regulation of inflammatory cytokines. Most people get virtually zero K2 in their diet unless they're eating natto, a fermented soybean product from Japan that most Westerners find, let's say, challenging. Supplementation with 200 micrograms of MK7 daily, taken with a fat-containing meal for absorption, is the dosage supported by the literature. And here's something your dentist will absolutely never tell you. If you've been taking vitamin D for bone health, which many people over 50 are, without K2, you may actually be making your situation worse. Vitamin D increases calcium absorption, but without K2 to direct that calcium, it can end up deposited in your arteries and soft tissues instead of your bones and teeth. These two vitamins work as a team. Taking one without the other is a biochemical mistake that millions of people are making right now. And now, secret number 7, the absolute king. Score 10 out of 10. Oral probiotics with specific strains targeting periodontal pathogens, not gut probiotics, not the yogurt you eat at breakfast. Specific, clinically studied strains designed to colonize the oral cavity and fundamentally reshape your mouth's microbiome. The strain you need to know about is Lactobacillus reuteri, specifically the strains DSM 17938 and ATCC PTA 5289. Research published in the Journal of Clinical Periodontology showed that these strains, when delivered as a lozenge that dissolves slowly in the mouth, significantly reduced pocket depth, reduced bleeding on probing, and reduced levels of the key periodontal pathogens Porphyromonas gingivalis and Aggregatibacter actinomystum comitans. These are the bacteria that are most aggressively destroying your gum tissue. But here's the critical part, and this is the biggest preparation error I see. People take oral probiotics the same way they take gut probiotics. They swallow a capsule with water. That's useless for your gums. Completely useless. The probiotic has to colonize your oral cavity, not your intestines. You need a lozenge or a chewable tablet that you dissolve slowly in your mouth, ideally after brushing at night, so the beneficial bacteria have 8 hours of undisturbed time to adhere to your gum tissue and begin establishing colonies. And you cannot use antibacterial mouthwash and oral probiotics at the same time. This is the mistake that makes me want to pull my hair out. People use Listerine, which kills everything, and then 10 minutes later pop an oral probiotic. You just killed the very organisms you're trying to plant. It's like spraying herbicide on your garden and then wondering why your seeds won't grow. When Lactobacillus reuteri colonizes your gum line, it does something remarkable. It produces antimicrobial compounds called reuteri that selectively inhibit pathogenic bacteria without destroying beneficial species. It literally rebalances your oral ecosystem from the ground up, and it disrupts quorum sensing among the pathogens, preventing them from coordinating their attacks. This is not masking symptoms. This is biological warfare on your behalf, fought by organisms that evolved alongside human beings for hundreds of thousands of years. Now imagine this. Imagine it's 30 days from now. You wake up, you run your tongue along your gum line, and instead of that soft, spongy feeling, instead of the slight metallic taste of blood when you brush, your gums feel firm, dense, tight against your teeth. You look in the mirror and the tissue is pink instead of red. The recession that's been creeping along for years has stopped, and in some areas you can actually see new tissue covering what used to be exposed root surface. This is not fantasy. This is what happens when you stop chasing symptoms and start addressing the biology. So here is your 30-day protocol. Before you start today, take a close-up photo of your gum line. Use your phone, get good lighting. Document where the recession is worst. You'll want this for comparison. Every morning, take 600 milligrams of NaC on an empty stomach, 30 minutes before breakfast. With breakfast, take a liposomal vitamin C, 500 milligrams, along with 200 micrograms of vitamin K2, Mk7, and whatever vitamin D you're currently taking, with food that contains fat. At midday, dissolve a xylitol lozenge or swish a xylitol rinse. Take another 500 milligrams of liposomal vitamin C after lunch, another xylitol exposure. Before dinner, take your second 600 milligrams of NaC. After dinner, a third xylitol exposure. And at night, this is the most important moment, brush your teeth gently with a soft bristle brush. No mouthwash. None. Then apply a small amount of ubiquinol CoQ10 directly to your gum line with a clean finger, focusing on areas of recession. Then dissolve a Lactobacillus reuteri oral probiotic lozenge slowly in your mouth. Do not eat, drink, or rinse after this. Go to sleep and let those beneficial bacteria do their work for 8 hours. That's it. The total cost of this protocol is roughly 40 to 60 cents per day. Compare that to a single gum graft surgery that runs $3,000 to $5,000 per tooth and requires weeks of painful recovery, with no guarantee the graft will hold, because it did nothing to address the biological reasons your gums receded in the first place. After 30 days, take another photo. Same angle, same lighting, compare them. I think you're going to be stunned. And when you are, come back to this video and tell me about it in the comments, because those stories matter. They help other people believe that this is possible. Your dentist is trained to cut, scrape, and fill. That's the model. And those skills have their place. But the science of gum regeneration is a biological science, not a surgical one. Your body built those gums in the first place. Given the right raw materials, the right microbial environment, and the right biochemical conditions, it can rebuild them. You just have to give it what it actually needs. If you found this valuable, subscribe and hit that notification bell, because next week, I'm going to cover something even more important: the connection between periodontal bacteria and cardiovascular disease, and why the health of your gums might be the single best predictor of your heart attack risk. You're not going to want to miss that. I'll see you then.